Three things I saw in the ED today. So I started at 8, and at 8:02 we had this 22-year-old female come into resus with a butter knife this long, basically all the way into her abdomen as a self-harm injury. She has PTSD and BPD, borderline personality disorder, with known self-harm history. And so we were very concerned for an acute abdomen. She had a CT, and the knife was not breaking through the peritoneum. So trauma just took her to theaters and did a washout and a tetanus shot. And of course, a mental health review. Number 2, we had an 88-year-old guy come in with this lumbar lower back pain that was radiating down his right buttock on certain positions. Sounds like sciatica. I did a straight leg test with him. It was definitely sciatica. It had that shooting pain that goes down the buttock. So I let the consultant know. The consultant comes and does the straight leg test, and the leg is healed. No sciatica. What? Anyway, I guess things like this just happen, but it made me look like a fool in front of the consultant. We discharged him home with some good old-fashioned Panadine Fort. The third thing was a code black, so that is personal threat. This was a guy who was brought in by police. Police were just asking some questions around the neighborhood relating to something else, and when they asked this guy, they further probed and found out who he really was, and found out that he was in breach of a CTO, a community treatment order, which is a mandatory psychiatric treatment order for people who are in the community. He has known schizophrenia and bipolar disorder. And so he came in, he was completely calm and compliant with the police. They did arrest him, they did cuff him because he had previously ran away from them. But the police reported that he was fine. He came in, he was sitting in bed, he was fine. They uncuffed him, he was chilling. An hour went by because the doctors were really busy. And then randomly, the police and the security guards are on the phone to someone else talking about a different patient. One of the security guards just gets tackled from behind, dropped to the floor. All the security guards jump on this guy. Code black is called. I'm right next door with another patient, popping my head over. This guy's, I don't know if you've ever seen someone fight for their life. Like, this guy thinks he's dying. And, he's got 5 big security guards that are on him within a couple of seconds. I'm on the right leg. Another doctor's on the left leg, just holding the legs down. Security's all over the body. They have special techniques to pin someone down without causing damage. What was really interesting? I mean, we hear so much about police brutality and that kind of thing, but these guys were really loving. They kept saying, mate, you're safe. Just stop moving. Remain calm. You are safe. The doctors are here to help. Because obviously this guy's having... who knows, probably a psychotic break, and he has some paranoia or some delusions that he has to fight for his life. But what would you give as a medical student? As a doctor you should give it, but what would you give to sedate someone pharmacologically if they were going crazy on the wards? What do you give them? 5 milligrams droperidol, 5 milligrams of midazolam. I learned 10 milligrams of droperidol or 5 of haloperidol. Those are both antipsychotics, but apparently mixing it with a benzomidaz and doing 5 and 5 is better. So that's what they did. And he chilled out. It took a couple of minutes for it to take effect. And then he kind of chilled out. And then it was magical. He recognized one of the security guards because they knew each other. The guy had been in and out of ED before. And they started speaking in Arabic together. And they started talking about, their shared religion and God. And they had this really nice connection. And so... he started to chill out as the drugs took in. We put him into a resus bed, and I had to cannulate him, which was very high risk. And I didn't have to do it. I offered to do it. I wanted to do it. But it's a very high risk needle injury because even if he's in 4-point restraints, which we had to take it off to get access to one of his veins, so he was actually at a free arm, that's a really high-risk needle stick injury. So I had to be very cautious and very ready to quickly retract the needle into its needle-safe container if any agitation happened. But he was very sedated, so it was quite safe. But there was some risks involved. Anyway, so I also had 5 security staff, 2 police officers, and then their colleagues, so another 4 police officers, the ED doctor and a bunch of nurses, all watching me put this cannula in and all kind of ready to respond if anything happened. And I really didn't want to miss this cannula, so that would have been embarrassing, but luckily I got it. And it was a big one. It was an 18 gauge, so you don't want to have to cannulate someone like this twice. But it was very sweet. One of the security guards who was speaking with them in Arabic was saying, look, everything's fine. And then they had this very close relationship. The security guard was instrumental in his in him being kind of compliant and was saying, look, these are the people who are going to help you, make you feel better. They're just taking blood tests. They're just, putting a saturation probe. Because before he was saying, don't, he was just losing it, saying, don't touch me. Obviously in this very paranoid state, very distressing. But it's definitely the first time I've put a cannula in to someone who wanted to kill me. Because when we were pinning him down, he's just saying, I'm going to kill you. He's trying to kick me, he's everything. So very action-packed day. Anyway, he's sedated now. Psychiatry teams have come to speak with him, and he'll probably have to have an inpatient admission against his will under a schedule, and that would be to optimize his medication management so that he doesn't have unpredictable violent outbursts and can be a safe member of society. He was not technically under arrest, and I don't think the cops wanted to press charges or the security guards. If you want to hear more about my musings and reflections of my time in hospital, please feel free to subscribe, like the video, that really helps me out. And I have a whole list of hospital reflections about patients that I've seen and the impact it's had on me. But I thought I'd put this quick video together to just share a little bit of the cases you might see in ED. It's today kind of made me feel like I could be an ED doctor. I just love the kind of controlled chaos. Heaps of other things happened today. I didn't even tell you about the penis that was completely swollen in a young 22-year-old, 4 times its normal size. I didn't tell you about the fact that the EMR shut down, so it was all paper-based for at the worst possible time in the day. A bunch of other patients I saw were super interesting. Pseudo-seizures, psychogenic seizures, so someone having a seizure, tonic and clonic, but actually totally aware and talking, which technically is not a seizure. So she believes she was having a seizure. Her bloody heart rate was 200, but it's not a real true seizure. It's psychogenic. And one of the doctors gave a bit of saline to calm the pseudo-seizure down, and then the patient relaxes. So incredible stuff, very interesting. Anyway, that's it for this video. I'm gonna go have a cup of tea, and I'll see you guys in the next video. Bye for now.